Welcome to the Single Best Answer series from the UCL School of Surgery. Don't worry if you don't know the answer straight away. They're meant to stimulate your learning and develop your critical thinking. I'm Ashiv Patel, and today we'll be covering topic 2 of lower GI surgery. This is the vignette. Press pause whilst you read it. Press play again when you're ready to move on. Question 1. Given the likely diagnosis, which of the following is the most appropriate initial investigation? Press pause while you have a think. You can even rewind back to the vignette. Press play again when you think you've got the answer. The correct answer is C, CT abdo-pelvis with IV contrast. As this patient has presented with colicky abdominal pain and abdominal distension and constipation, having not opened his bowels for 8 days with vomiting, it is likely that he has some form of bowel obstruction, likely large bowel. In this instance, the best form of imaging is a CT abdo-pelvis with IV contrast. Question 2. Which of the following would make the diagnosis more likely? Press pause while you have a think. You can even rewind back to the vignette. Press play again when you think you've got the answer. The correct answer is E, a history of tenesmus. Tenesmus can be caused by constipation, secondary to IBD, or more likely in this instance, colorectal cancer. Option A, normal bowel sounds, would not point towards a diagnosis of bowel obstruction. Soft stools in the rectum would also not point towards bowel obstruction being the correct diagnosis. And nitrates on a urine dipstick would point towards a UTI being the cause of this man's symptoms. And a negative fecal occult blood test just tells us that there is no blood in the patient's stool. It doesn't point towards bowel obstruction being the likely diagnosis. Thanks for watching, and remember, you can discuss any of the questions and answers with any of the surgical doctors on your placements.